In the HSE, which is where I work, there's a huge variety of services provided, and everyone who's engaging with us is starting a journey of some sort, whether you're going to see your GP, whether you're being admitted to hospital for a planned operation coming as an emergency, or receiving services in the community, such as those provided to disabled persons. These are all journeys, and what's different about the Patient Safety Initiative and Patient Safety First is that all of the people involved in that journey are there. So the passenger, the patient, is at the centre. The people who commission services are there. The people who pay for services are there. So if you're going on a rail journey, you've got the people who design the route, you've got the people who provide the tracks, you've got the people who provide the carriages, all working together with patient in mind and patient outcome in mind. And that really differs quite strongly from much previous work that's taken place where we haven't been as cohesive. Critical to that is a leadership agenda, so the process is being led actively through the chairmanship of the Chief Medical Officer. But the participants around the table and the working together is what's different about it. There are many initiatives that the HSE is working on to promote and provide higher quality, safer care, but particular ones I would pick out would be the Your Service, Your Say initiative, which places the service user, the patient or user, at the centre of decision making and planning, so that service users can genuinely be active participants in their care. A second initiative relates to the disease care programs. So in these programs, we're defining centrally, with collaboration from doctors, nurses, other healthcare professionals, how services should be provided and how they should be delivered. And this will have legislative backing. A third initiative relates to accountability. Unfortunately, on occasion, there have been some failures in healthcare service provision, and that has hurt people. And above all else, we want to have safe services and to do no harm. And in relation to this, we have found deficits in the past in our accountability structure. So we all understand and have a mutual understanding who is responsible for what. And this is a specific initiative the HSE is developing. We're also working with consultants and other disciplines up and down the country and primary care doctors in a clinical directors program, providing clinical leadership at local, regional and national level to all our work. Well, relating to particular initiatives that I would select as ones to give prominence to, after service user involvement is fully implemented, the patient really is at the centre of decision making and planning. So we have informed patients or patient advocates sitting with us on committees, planning how services are provided, planning how things like, for example, our complaints processes work. And this would place the service user at the centre. In relation to the disease programs, the care programs, focusing perhaps for a moment on chronic diseases such as diabetes or heart failure, this means that clinical leaders are driving a consensus nationally where we're using best evidence to provide the best care in a cost-effective way, and that all departments, all surgeries are up and down the country working in a standard way, providing service and providing best value for money. In relation to the accountability work, it means that everyone will have a clear understanding of where their responsibilities begin and end, so that they are not falling between two stools. Responsibilities are carried out and everyone knows to whom they report. In relation to the wider safety agenda, this work brings together decision-making around resource allocation and how budgets are spent into the same room as the quality and safety agenda. So, for example, issues such as prescription errors are addressed and addressed properly in the same room that decisions are made around planning resource utilisation in the area of prescribing.